time for another Perioperative Coach. In this series, we give you top tips on perioperative care from experts and world leaders. This is Series 2. Be sure to check our back catalogue on www.topmedtalk.com for Series 1. Top Med Talk.
Hello, I'm Desiree Chappell, and this is Top Med Talk. I'm here with Monty Mythen, Editor-in-Chief. Hello, Monty. How are you?
I'm Desiree. I'm good, thank you.
Great. We have Dr. Frances Chung. She is an anesthesiologist and on the board of directors. She's a professor of the Department of Anesthesiology and Pain Medicine at the University Health Network and University of Toronto. And she is also Res Med Chair of Anesthesiology Sleep Medicine at the University Health Network. We also have Kurt Pfeiffer, who is the Vice President of SPOCIA this year. He's an internal medicine physician at the Medical College of Wisconsin. Thank you both for sitting down and joining us on Top Med Talk.
You.
Yeah. You know, Stop Bang is one of your, is kind of what you're known for. And that's one of those things that I think a lot of people are really putting into practice. And I love some of the things that you had to say about, you know, really utilizing that in practice. So can you tell us a little bit more about Stop Bang and your experience with that and utilization of it?
So the Stop Bang is a sleep apnea questionnaire, and I actually developed it because what happens with obstructive sleep apnea patient, they do have complication. I do have a patient that have complication, and I said to myself, okay, how can I identify patients that have sleep apnea that I don't know about and coming to the pre-op clinic because it can result in death or near death, mortality and morbidity. So I developed this tool a few years ago now, and it published in 2008 in Anesthesiology's 2009. And I have put this on the website, www.stopbang.ca. So stopbang.ca, Canada, because somebody copied it as stopbang.com, exactly the same, and they make money on it, asking people to fill in questionnaire. So anyway, it has been widely adopted, not only in the pre-op area, but by the sleep physician, cardiologist, dentists, ENT, and some family doctors. So actually, I think the good thing about it, it can identify high-risk patients. So if the score is 0 to 2, and actually it means that the patient has very little risk of sleep apnea. So it's just 8 questions, very simple, like snoring, tiredness, fatigue, high blood pressure, BMI, neck circumference, gender, and all these. So very simple. I didn't use a computerized system because the 8 questions are not weighted equally. And I know that it doesn't weigh equally, but I want to be simple and stupid. And it can be used without computer. Yeah. So that is why I purposely did not weight it. And it's easy to use, and that's why it's wide adoption. Yeah.
So we've done a few pieces before on Stop Bang from some OSA experts and enthusiasts, put it that way, for identifying OSA. And Kurt, you raised it in your lecture as well, using it as a screening tool. Could you expand on that for a second?
Yes, and it's, as Frances pointed out, it's, keeping it simple, you might say, well, then that's going to mean that it's not going to be perfect, but one of the fallacies in perioperative medicine is that there's some perfect tool, some universal thing that's going to work for everybody all the time. And that's not really what any of our screening, the purpose should be. It's try to increase the chances that we're going to identify those patients at higher risk, because those are the ones that if we focus time and energy on, then we can potentially do an intervention to improve their risk. And that's why I think so much of the follow-up work to what Frances has done with Stop Bang of then identifying, well, Stop Bang of 5 or higher, they're at higher risk, but then who's really even at the higher end in that group? So the Stop Bang of 6, indicating that's an even higher risk patient, or a Stop Bang that's elevated along with an elevated bicarb, that those are the patients you really need to worry about. And for instance, if they're having a non-urgent surgery, you would actually consider holding up that surgery to pursue further evaluation by sleep medicine before you go ahead. And so we're not stopping a ton of surgeries. We're only stopping them in the patients who are at the highest risk based on that screening. And then for all the others where the screening identifies them as potentially at risk, although you might say, well, you don't do anything. We don't do anything in the pre-op setting because there's not much we can do to make a person that much healthier in this regard. But what we can do is make sure that we've got the right resources and plans in place perioperatively to try and keep them out of trouble. And as I had pointed out in my talk, it's actually made it somewhat frustrating in modern day era to see what is the risk related to sleep apnea, because almost all hospitals have adopted policies and practices that are already mitigating a lot of that risk. Yeah. And so when you go back and try to see if an intervention you're doing is helping, you're already doing so many things that if you don't see a response, it's not necessarily because that doesn't work. It's because without knowing it, you're already doing a ton that's focused on that screening effort.
Top Med Talk.
Nick Majerison here. Thank you for listening to Top Med Talk. Now, make sure you've subscribed to Top Med Talk on your podcatcher or however it is that you're listening to us at the moment. And you're spoilt for choice. We're on pretty much every single podcast platform you could think of. So make sure you've subscribed. Make sure you've engaged with us on social media, Twitter, Facebook, LinkedIn, YouTube. And make sure you've signed up for our email updates on topmedtalk.com. If you get yourself there, you'll find a website that contains all of the podcasts that we've ever done, and it gives you the chance to sign up for our email updates. That way we can always get in touch with you and tell you what we're up to. Oh, and while you're online, check out ebpom.org/meetings. While you're there, get excited about EBPOM London 2019, the London Perioperative Medicine Congress. It's on July the 2nd, and it's one of many meetings that EBPOM organises around the world in order to communicate the perioperative medicine message. Have a look, ebpom.org/meetings.